The NHS must look after the health and well-being of children. That means work that prevents ill health in the first place and also medical care when needed. Children use NHS services often. Preschool children will see a GP about 6 times a year and account for about 28% of A&E admissions. There are also about 60,000 vulnerable children in care at any given time. Let's take a look at some examples from across England where high-quality children's care is already provided. Healthcare for very sick children calls for experienced clinicians and specialist equipment. Here, a paediatrician, Dr. Stephen Ryan, takes us on a tour of Liverpool's Alder-Hey Children's Hospital and explains why.
This is Alder-Hey Hospital in Liverpool. What we've got here is a bit of Alder-Hey's famous history and tradition, the corridor, which is 1/4 of a mile long. You'll find little toddlers, preschoolers coming along, touching the pictures and really enjoying them, so that when they come into the hospital they get a sense of enjoyment, they're not so concerned, it helps them relax. So I think it's absolutely fantastic. So this is the orthopaedic ward. This is a specialist ward. It's for children with bone problems, fractures and children who are coming in for very complicated operations. It's the sort of thing that you can't do in every district hospital. This ward takes children from birth right the way through to 19 years of age. It's for children, it's decorated in that way, it's very friendly for them and meets their needs particularly, and I think that's certainly much better than the children being on an adult ward some way.
I think it's amazing really. As a child I think hospitals were quite frightening places, but this is very welcoming. They all love all the children, they just treat them so well. It's almost like a home from home really.
A lot of childhood illnesses actually don't need specialised care. 25% of general practice consultations are children. They don't need to come to our hospital. District general hospitals provide a large part of the care, but then there is the children with very specialised needs where we need to bring the team in, all of the components together to give the very best pathway of care. And we know that in the district general hospitals in this part of the world that actually more and more of the orthopaedic operations are coming here to Alder-Hey to be undertaken because the skills are here.
The NHS also provides medical and non-medical care for our vulnerable children. We visited a short break care centre in Oxford, which is an excellent example on how, by working with other organisations, we can care for children with disabilities and support their parents.
We're in Viking House, which is a short break centre for disabled children in Oxford. Children come here because they've got particularly complex needs. They come here to give their parents and their brothers and sisters time perhaps to do other things and to recharge their batteries, and the children come here to have a good time. It's funded by the County Council, by Health, and also by Barnardo's, which is a charity that we've been working with for some time. We also have a lot of voluntary sector people who help out. One of the things that we particularly wanted to get right about the design of the building was to make sure that it was really going to work for the children who come here. And one of the young people who was able to help us was a young man called Sean.
This is the security room.
And he was able to tell us about what didn't work and what he wanted.
I'm in the sensory room.
And the architect used that as part of the design brief.
This is a bedroom.
It's just so much better when it's done like this, with agencies working together. Everybody can contribute their own creative ideas, and working with the voluntary sector has added immeasurably to what we can do as statutory agencies.
It's not just having to argue over, wait a minute, that's my money, or that's my resource. It means it's just together and we decide together. Instincts across organisations is I need to protect my bit. And to get over that hurdle and go, OK, we are going to trust each other on this, to actually push the stuff together is a big thing, but it works really well.
As far as possible, the NHS should be aiming to provide most healthcare closer to the patient's home. But for some specialist treatment, the evidence will suggest that best care is provided from a dedicated location. Let's take a look at a world-famous hospital in Manchester to find out why.
This is the Christie Hospital in Manchester. It's a specialist tertiary centre for cancer treatment. Every year we're treating 10,000 new patients. Well, a specialist hospital like this allows us to concentrate expertise. We also have treatments which you would not find in a district general hospital. For example, complex surgery, leading-edge chemotherapy and radiotherapy treatment. It also enables us, because we've got the expertise, to do leading-edge clinical trial work. We've concentrated here on teenage cancer.
Young people that are being treated for cancer require very different care, both from a nursing point of view and from an environment point of view. So we try and make it a non-clinical environment, a little bit like home from home. And it's really vital that they're with their own age group to get that peer support.
I think that being treated on a young person's ward, the staff there are trained to understand the specific needs of a specific age group.
Patients are more than happy to travel a distance if they feel they're getting the right treatment. They're more confident that they're going to get the very best treatment with the best chance of cure. Well, some of the outcomes for cancer are very good indeed. It depends a little bit on how early the cancer is when it's first discovered. But for example, for laryngeal cancer, we would expect something like 90–95% cure.
There are 7 units similar to this throughout the UK, but it certainly isn't enough to treat all the young people with cancer that are out there. We do know that a lot of young people are in district generals, still in adult wards, still in children's wards, and they get a raw deal really and don't get the services that they need.
I was on an adult ward in a general hospital for 2 days first. I hated it. I couldn't wait to come here.